So welcome. I'd like to say welcome as well, and also thank you for joining us. And we're going to jump right in because we know everybody's time is very tight. We want to respect that. So the reason we're having this is COVID-19 and all that's happening around that with the stress within the healthcare industry. Not only really the frontline workers, which is where it's felt most intensely, but within the whole healthcare system. So we asked Eleanor to join us, and I'd like to do a brief introduction of her. Eleanor is the Chief Executive Officer of Cohort for Care, and she's a registered nurse and a certified personal development coach and a certified compassion fatigue professional. Her practice focuses around compassion fatigue and burnout, and this is a direct result of many years of experience working for and consulting with leaders and other professional helpers, if you will, and seeing the tremendous impact of such issues. In her work, she has led workshops for larger groups, coached individuals, and consulted with organizations dealing with the cost of caring for others. Her medical background uniquely positions her to relate with medical professionals. She holds a BSN from Samford University and a graduate certificate in performance coaching from Lipscomb University in Nashville. Welcome, Eleanor Wells.
Thank you. So
So,
glad to be here.
yeah, so glad to have you here. So, this is a very timely topic. And although I think from some of the data that you have shared with me, obviously compassion fatigue and burnout has been a topic that's been rising to the surface
Mhm.
over the last couple of years, with some surveys indicating between 40 and 51% of physicians experiencing burnout, and then a 40% prevalence of compassion fatigue.
Mhm.
So now we're in a pandemic. Sorry, I can say this, pandemic.
There you go.
Yeah. How did you get involved in this work?
It's interesting. I have really spent my life, my adult life, working with nonprofits and volunteer and on staff of organizations. And 4 or 5 years ago, I was at a trauma workshop for the staff of a organization here in town that serves women who are dealing with addiction. And it was very informative, but the speaker made one comment that just jumped out at me. And she said that those who work with those who are going through trauma can experience trauma themselves. That our brains don't know how to differentiate between the trauma that we're hearing from someone else and our own trauma. And she gave it a name, compassion fatigue, and I'd never heard of that before. And it just started me on a journey of learning more about it because I had seen the impact of compassion fatigue and burnout. I just didn't know the name. And
Mhm.
so I got very interested to learn more about it. And as I became a coach, I had the opportunity to start working with professionals as they were dealing and struggling with burnout and compassion fatigue. So that's just kind of what brought me here. And then when all this broke with the pandemic, my first response was I was very concerned about those who had the disease, that virus, but I kept being concerned about who was taking care of the healthcare professionals because I knew that they were being stretched in ways they never probably had experienced before. So I'm just so delighted to have this opportunity to talk about it because I think it's important and I think we need to be aware that those that are on the front line are going to have some consequences themselves from this.
Yes. Yeah. So where or how can our audience get started in understanding compassion fatigue and burnout in the time that we have here, the 30 minutes that we have?
Yeah, we're going to break it up. We're going to start with just kind of diagnosing, and we're going to talk about that as we talk about how we can preserve our well being and protecting ourselves. And then we're going to talk a little bit more about prevention and action. And in that area, we're going to be looking at how can we prevent future fatigue and what are some care and resources that we can provide for those who are struggling with this right now. So my hope is that at the end of this 30 minutes that you'll walk away with some hope and encouragement, some really practical help that will make a difference in your own life.
That's wonderful. So you talk about preserving your well-being. I'm sure you're going to walk us through that. Can you tell us more about that?
Yeah, it's interesting. I've done workshops on compassion fatigue, and I would have started out normally talking about signs and symptoms and diagnosis of compassion fatigue, but it occurs to me that we are in a situation where we need to do things a bit differently. Here's the example. If you walked up to someone or a good friend of yours, you were with them and they started having a heart attack, the first thing you would do, you wouldn't turn to them and say, oh my goodness, you really need to back off all your saturated fats and get to an exercise program. So it seems a bit premature for us to jump into signs and symptoms first, because I think our first responders need first responders.
Mhm.
Those who are dealing with a crisis situation, they need a crisis response. So I've kind of couched it in a way that I think will be helpful for people to think about, but I put it in a CPR format because that's what we do for people who are having a heart attack. We give them CPR. So I think with our first responders, those who are on the front line, we need to be very aware that these folks need care. They need someone that cares what they're going through and understanding the demands that are being put on them. Our first responders need a place to cry where they can cry out of fear, cry out of desperation, cry out of sadness, cry out of their doubts. We're going to couch this conversation tonight from a faith perspective. And in Jeremiah, it says, call unto me and I will answer you, and I will tell you great and incomparable things you don't know. So our first responders need to be able to be cared for and to cry out. And then next, they need people. They need people to come alongside of them. So oftentimes we feel like we're very alone when we're in situations that are unfamiliar or uncomfortable. And so our frontline medical professionals need to know they're not the only ones that are having feelings of fear or inadequacy or lack of feeling competent, all these things that could come up. So we need to be there for each other and supporting one another. It's really interesting in today's world, research is proving some things that we've known for a long time, but even in our own brains, our brains will put out chemicals when someone comes alongside of us and speaks into us. And that can be very healing from a very physical viewpoint. So I just think that's really cool that the body really responds physically in what we know how to do to stand by people. And then last, the R part of the CPR, the care, the people. Frontline medical professionals need rest and restoration right now. And that may be really hard to do and to press that pause button. But I think that's where significant others can come alongside and help them create boundaries and provide for that rest that they so desperately need. And I also want to make a little caveat right here too, and I'm glad I said the word significant others. Significant others are also very much involved with what's going on the front lines. If your loved one is a frontline professional, your life has also changed dramatically. So you may be also having some feelings of compassion fatigue because you're trying so hard to take care of your frontline responder. So I want significant others to also look at this information and realize they may very likely be feeling very similarly to what those frontline responders are feeling.
It's really nice to have that connection with scripture. Thank you for bringing that in. I
Yeah.
always like remembering where the true source of our comfort is. So you've talked about both compassion fatigue as well as burnout.
Mhm. Yeah.
Are you addressing both here? And really, is there a difference? Here we go.
Yeah. Yeah. Yes, there is a difference, but it really, and I'm going to share what those differences are tonight, but I don't want us to get hung up in it because they can present and look very similar. But here's some uh, definitions that's in the literature right now about what compassion fatigue is. So compassion fatigue is an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the helper. That's like what I explained that I learned in that training about trauma, that you can have your own feelings of or experiences with trauma, even if you haven't personally dealt with it, but you've just lived it and heard it through others. But compassion fatigue is also the profound emotional and physical erosion that takes place when helpers are unable to refuel and regenerate. It leads to an exhaustion of compassion for others and themselves. And I think that's probably what we're seeing so much right now, is just this profound emotional and physical tiredness that people are feeling. So that's compassion fatigue. So now let's look at what burnout is. Burnout is really comes more from the workplace. It's the process manifested by emotional exhaustion and withdrawal related to heavy workloads and organizational demands. So you can see right now, our medical professionals are dealing with both, or they're dealing with all of it. They're having increased workloads. They're having demands put on them in ways that they may have not experienced before. They may be experiencing, hearing, and watching trauma of others that they've not had at this level. And then they're also just exhausted. So you can see that both burnout and compassion fatigue very much are really prevalent to where we are today.
Okay, so a couple questions here. Is
Yeah.
everyone at risk for compassion fatigue? Um, and is there a way to diagnose and understand the symptoms of compassion fatigue, particularly in where we are right now?
Yeah. Um, well, it's interesting. The people that are the most at risk are the ones that are highly motivated and dedicated. So you think about medical professionals that are on the front lines. They are our highly dedicated, motivated individuals. I know I was so struck by seeing those videos of the plane load of healthcare professionals that were flying to New York to help in those situations. They are, they are so gung ho, and they are the very ones that are probably at the most risk of experiencing compassion fatigue and burnout. So let's talk just a minute about what the signs and symptoms are. And yes, thank you. So the first thing, it's really interesting. The literature shows one of the very first signs is a loss of sense of humor. So if you're one of those medical professionals and you are, on the front lines, and all of a sudden nothing's funny anymore, that might be a red flag that there's more going on with you that you may need to pay attention. Some other things are emotional numbness, when you can't be more sad. You're just sad and you're just numb to it. You may get home from work and you have a really hard time relaxing because you've just been on go, go, go. You have a difficulty separating work from your personal life. I know that can happen so easily. It's hard to walk through the door and suddenly become the mom or the dad or the sister or the daughter or whatever your role is in your family when you've been in such a difficult situation at work. You may find that you've just got a lowered frustration tolerance. You may find yourself snapping at people that you love or people that you're working with. That can also be a sign. And right now, particularly, you could have a real negative change in your worldview. You could see how it would be so easy to, I know I'm just struggling with this right now, seeing people in the grocery store. They're not just my neighbor, it's someone who might have the virus. And so my worldview has changed about the people that are around me. Suddenly they're not my friend. There may be a virus carrier and could be scary. ineffective or self-destructive, self-soothing behaviors. There's a lot of humor going on right now about, 5 o'clock, it's time for that cocktail. We need that time to kind of decompress and listen, no problem with that here. I just think we need to pay attention that if we're starting to overuse chemicals, medicines, alcohol, and it can also be overspending. You're on Amazon every night, or over exercising. You're not eating like you should. You should be really aware that that could be a sign or a symptom. And then also we see that you could be having feelings that you're just not competent in your work anymore. Areas that you've always felt so strongly about and knew you could do, suddenly you just don't have that competent feeling that what you are able to provide at work. And then next, we have one more slide. Yes, profound exhaustion. I think we've talked about that. You're just beyond tired. Sleep disturbance. I've been reading a lot about people having recurring dreams and just having a really hard time of sleeping. Cynicism. Sometimes the way we cope with hard situations is just to detach and be negative. So we just don't want to be involved anymore. And you may be feeling a diminished sense of purpose and enjoyment in your career, diminished functioning in your non-professional areas of life, feeling depressed, loss of hope. And then you may be also experiencing your own physical symptoms, headaches, GI problems, frequent colds, and then just dread of working with certain individuals. So all of this cluster of signs and symptoms, not everybody's going to have all of it, and you may only have bits and pieces, but you just need to be aware when you start feeling this way that you may be at a place where you are experiencing compassion fatigue and burnout.
It is so easy to see why this is so important, Eleanor, and how it could be so prevalent at this particular time.
Mm-hmm.
So our audience is primarily made up of healthcare workers, as we've already discussed, and they're in this now.
Yeah.
You've talked about CPR, but one of the other things that you brought up a little earlier was protecting yourself. So what are your recommendations or advice on that going forward?
Yeah. It's really clear in the literature that the way to combat compassion fatigue and burnout is self-care. And that sounds so flippant and so easy to say. I think particularly in the Christian community, we struggle with that because that may feel selfish if we're starting to care for ourselves. So how do we deal with that? But that really is the most important thing that we can do, is take care of yourself. As a Christian, as I was really trying to kind of sort out what does self-care look like and how do I believe and think about that in the context of my faith, I went to the Gospels and just looked at the life of Christ and just how did he take care of himself? How did he function in his day-to-day world? And for those of us who know scripture and know stories from the Bible, we know that we see time and time again that Jesus pulled away by himself and went away from the crowd. And he spent time with his Father early in the morning and late at night and on the mountain. And he found that so important. And he's God. That was kind of startling to me. If God thinks he needs that time away, why would I think I wouldn't? And one verse in particular really stood out to me, and I'm just going to read it. It's from the Gospel of Mark. And it says, because so many people were coming and going that they didn't even have a chance to eat, he said to them, and to them is his disciples, come with me by yourselves to a quiet place and get some rest. So they went away by themselves in a boat to a solitary place. So that's wonderful. I love that picture that Jesus was caring for those he loved, his disciples. He knew that they needed time to rest, they needed time to eat. And so he put them in a boat and went to the middle of the lake where nobody could get them. But the other thing that occurred to me was when he did that, he left people who were waiting on him, that were waiting for him to teach, that were waiting for him to heal. And he left the crowd because he felt like it was important to do that. So I think that's a really wonderful example of when we're feeling like we can't get away. Um, there's some things I think we need to think about is how do we look at our role? And I think so often those of us who are in caring professions, we kind of feel like, well, if I don't do it, who will?
Mhm.
And I feel like we can look again to Jesus when he said, I didn't come to do my will, I came to do the Father's will. So I think that again gives us a place where we can say, okay, we need to see what God would have for us. Um, I also think we can think about, I think so oftentimes who we are is so connected to what we do that we forget to separate those two things. And in scripture, it says that I know the plans I have for you, declares the Lord, plans for welfare and not for evil, to give you a future and a hope. So he doesn't see us as our role, he sees us as a person and a person of worth and of caring, and he loves us so dearly. So those are just a couple of examples of, as we're looking at our role, we're looking at what we do, our commitment to those that we love, and our commitment to our career, just having scripture to kind of filter it through to help us realize that taking care of ourselves is not selfish. It helps us to be better prepared to take care of others. There's that always you hear on the airplane, put on your oxygen mask first before you put it on others. So if we want to be able to serve someone else, we've got to have our oxygen masks on.
That's really important encouragement. I know so many people, including myself, who feel like, we have to do more and more and more.
Hmm.
But if Jesus needed rest, we certainly do. Um,
Yeah.
and when you talk about self-care, Eleanor, talk through that a little bit for us.
Yeah. It can be really simple. Again, just a scripture that always kind of spoke to me. I learned it as a little bitty girl. It said Jesus grew in wisdom and in stature and in favor with God and man. And I kind of pondered, why was that in scripture? Why was that important? And it occurred to me one time that, it shows that Jesus was well rounded, that he took care of himself intellectually in wisdom, he took care of himself physically, he had a relationship, a spiritual relationship with God the Father, and then he also had relationship with others in his life, those that he loved and cared for. And to me, it just kind of gave a framework that would be very easy to use as we're looking at how we can care for ourselves. How are we eating? How are we feeding our minds? How are we feeding our spirits? What do our relational life look like? So as we're looking at, how we want to take care of ourselves, maybe that would give us structure or just a way to do that. And I think particularly right now, something I really want to encourage everyone, you need to find something that gives you joy, something that just is life-giving to you, whether that's digging in the garden or baking muffins or cleaning your house or whatever it is that you having a Zoom call with someone you love. I think particularly right now, we need to find those places in our life, those things that can really bring us joy, and they're healing, and they can help us combat the fatigue and the burnout that we're feeling.
Is it have to be for a certain period of time, do you think, or is it short snippets of it?
Um, you know, there's this whole adage of a balanced life, which I think is ridiculous. I mean, I would love to see someone who's had a balanced life. I've never had a life that was balanced. There are times in my life where work is more weighted than times with friends. I think it, I think we need all of it in our life, but we have to recognize that there's going to be seasons where some things are going to be more important than others. We may be spending more time with friends at one time of our life, more time with work at other times in our life. But I do think that this whole concept of self-care just needs to be a part of who we are and what we do every day.
Thank you. I often think we have to carve out so much time for it. When if you can
Yeah,
make a little bit of time each day is what I hear you saying is the important thing.
yes.
Yeah. So we have about 5 minutes left. And
Yeah.
let's move and talk about what organizations can do to support their staffs.
Yeah, I think it's really important right now that organizations look at what they're doing, how they're helping with their staff. I read this article, this quote: "It's critical to realize that this epidemic of compassion fatigue is a shared responsibility.
Mm.
Individuals are not going to resilience their way out of this. The medical system and the culture of medicine have to change." And I really believe that. I believe that organizations need to see areas where they can help support their staff, maybe by providing quiet rooms where they can get away, where they can have team building, just for the leadership to check in on people and see how they're doing. There's just lots of ways that organizations can do that, and I think we need to help organizations know how they can better serve their staff.
That's great. Um, so based on where we started this conversation, this is a nice checklist, and it sounds like it could really be utilized um, during this pandemic. See, I can say it,
Mhm.
and
Good.
after the pandemic as well. So we talked in the beginning that we were going to provide support and resources. So can you
Yeah.
tell us more about where they can reach that?
Yes, for those of you who are on the call tonight, you will be receiving by email some resources that I put together, some checklists on just to kind of evaluate where you are in your own self-care. There's some links to some other assessments that you can take, a burnout scale. There's the professional quality of life scale that really is the industry standard for compassion fatigue. There will be a link provided that you can take that and kind of see where you come out on that compassion fatigue scale. But I also am excited to share with you that some colleagues and I have joined together and have created a company that we're calling Cohort for Care. And we are positioned and ready to help those that are dealing with some of the issues that we've talked about. And also, we want to help on an organizational level. So here's our CPR plan that we are providing at free of charge during the crisis time. Our My colleagues and I, we're coaches. We have an industrial organizational psychologist. We have college professors. We come with a wealth of background and knowledge that we feel like that we can help those who are struggling right now. So in the care area, we're going to provide 3 20-minute individual coaching sessions. We can also, if you have a group that you would love to do a group coaching session with, we will provide 2 30-minute coaching sessions. So if there's some of you, some of your colleagues that you would like to have some coaching through this time, we can do that. And then resources like this webinar tonight that we're providing, that give people more of an understanding of what compassion fatigue and burnout is, but then also, like I said, on an organizational level as well. So just really excited about where we're going with Cohort for Care. It's cohortforcare.com. And there's where you can go there and fill out the contact information, and we will be in touch with you.
That's great. Thank you for that. And Eleanor, I just want to thank you for what you're doing and what your group is doing to create this kind of care. Um, it's so needed, and it's grateful to see that you all are reaching into the kingdom in that way, in that special way. So a few closing words. First, thank you for joining Nashville Institute of Faith and Work. We're very grateful that you all decided to come in tonight and to learn about this. And I would say just a reminder about preserve your well-being, protect yourself, preventing future fatigue, and take advantage of the care and the resources that have been shared here tonight. Be proud of your profession. Your work is important. You're caring for people during the first ever pandemic, at least in our lifetimes, I'm pretty sure, and giving them hope and strength. And if Jesus can take time to renew mind, body, and soul, you can. You can. So find the boat and row out to your special place of joy, and get renewed, and know that we were all praying for you. Whether it's on the front line or your work has increased exponentially because you're restructuring and trying to bring some organization out of chaos from a systems and a process perspective, you're all greatly valued. And we thank you for being here tonight.